implications for British government policy? And that connection that you just made between population and climate change. So as we go towards Glasgow and the government is under pressure to develop policies that are actually going to make a difference, do you think that in terms of its aid policy or its domestic policy, there are things that the government could be doing on the population front?
I don't think there's big things they should do in the UK population apart from stop worrying about stupid things, right? So the UK population about 20 years ago was about 60 million. It's about 68 million today. Latest forecasts suggest it could get to 74 million by 2050. It would be easier to get to net zero by 2050 in the UK if it was already stabilizing at 68. But we're talking here, you know, about plus or minus 10%. This isn't like, you know, the challenge for some other countries where the population could double, and whether or not it doubles has a major impact on the ease with which you get to net zero. When you're talking plus or minus 10%, it's not a radical impact on that. I mean, as I say, it would be easier if there were an already a stable or a falling population. So to me, the big issues in the UK, I think I'd much rather we had a stable population, because we would not be continually saying, we've got to build more houses, we've got to invade the green belt. I think for reasons to do with space and beauty and countryside, it would be much better if we were now stable. But that's more that than on the CO2 side. But I think for the UK, what you often find is don't worry about two things. Look, let's be clear on Brexit. I was a Remainer, but I always actually believed that the one benefit of exit was that you could decide your own rate of immigration, right? And I do think that we don't need immigrants in the UK. I don't buy that argument. And if, as a result of Brexit, we have a lower rate of immigration, and if at the same time we have a relatively low a birth rate, about 1.6, and if the two of those together end up believing that after the population goes up for a decade or so to maybe 72 or 73 million, it then begins to drift down, just don't worry about it. Don't start writing silly articles that saying we're short of workers and we desperately need immigrants, and don't start saying this is a disaster, we've got a baby bust. So the crucial thing is just to be sensible about it. On the global scale, I would not recommend that at COP26 there is a big focus on population, because to me, as I say, I think there is a side benefit of a population stabilization for the environment across the world. But I think if you position it as we've got to have population stabilization to deal with COP26, to deal with climate, you will produce an adverse effect. I mean, what we should be saying is there are disadvantages for the countries involved that have very high rapid rates of population, and they should want their women to be educated and free to choose. And the good news is if you do that, they will get stabilization of populations, which will be good for their prosperity. By the way, it will also make climate change balance a bit easier. But I don't think it helps the debate to put the climate change argument at the start of something. I think it can induce a whole load of reactions which are not helpful to the debate.
Thank you very much. So I will take some questions from the floor, and then after that I will take some questions from the internet. Lady in the front there, have we got any mics?
Another mic coming.
Hello. As the daughter of a physicist who used to specialize in thermodynamics, I've been aware of climate change for a little while. I would like to know if rapid and uncontrolled climate change is not going to trash all your demographic models.
Okay. Let's take three. Sorry, can we take... we've got both people who have asked questions before there, and one over there at the back who hasn't had a question before. Sorry, no chance. Yeah?
Do I ask it now?
Yes, please.
Yes. Quite a few countries in Africa, I think there are 56 countries in Africa, about 20 of them have a rate of fertility above 3% annually. Yep. Should British overseas aid, development aid, to developing countries be linked to those countries' effectiveness in limiting and reducing their fertility rate?
Mm-hmm. And one here who hasn't had one before.
The population of Japan has already decreased by 500,000 people in the past year, and I don't see them all in the streets desperate, crying, and out of money. So is it possible to have a model with decreasing population where we can still survive quite well?
Very good. So we have got the link between climate change and demography. Should aid be linked to success in population management? And is Japan a model for us going forward? Adair, I think I might ask you about whether Japan is a model for us going forward. What do you think about that?
I think it very unlikely that within the next, century, climate change would be sufficiently catastrophic to dramatically reduce the population of the world. I think it will be catastrophic. I think it could, severely hit the prosperity of the world. I think it could hit the standards of living, in particular, of many poorer people. But I think it's at least possible that it could actually, increase the population of the world, because by producing turmoil and lack of economic prosperity, I think it could slow the progress, the economic and educational progress, which is the biggest driver of population stabilization. So I would be very surprised if climate change per se suddenly says, well, we've only got 5 billion people by the end of the century. I think we're more likely to have 11 billion people living worse lives rather than 5 billion people. On those African countries, I would definitely not say, guys, you just hit a rate of 3.1%, I'm not giving you anything. What I would say is, I do think that a priority, and where we do have our overseas development aid, should be to support women's education and access to contraceptive services wherever it doesn't exist. And that may well be precisely in some of those countries. So I wouldn't try to create some sort of incentive structure of the sort you divide. Look, Japan, what is very interesting about Japan is people say, Japan, moribund society, low rate of growth. Just do a calculation and look at GDP per capita growth of Japan versus UK over the last 15 years. Who do you think's higher? They're roughly the same. Japan is growing GDP per capita roughly the same rate as the whole of Europe and the whole and the UK, because it is continuing to grow slightly. It is continuing to improve productivity. GDP stays about stable in nominal terms. There are slightly fewer people. GDP per capita goes up, and it is quite clearly, as you say, a prosperous society, and also in many ways, in many aspects of technology, an innovative society. So I would say, if it was going to decline slightly, I wouldn't get too worked up. I still think that if you when you end up with very low fertility rates, and it's important to know that the UN forecast of 125 coming down to 106 will be considerably more severe if the fertility of the last 2 years is maintained, because in Japan as elsewhere, there has been a significant downspike in fertility, perhaps to do with COVID-19. So I think when you look at the latest fertility rates in Japan and Korea and turn them into forecasts, I simply think it's just too much of a good thing, right? So I believe that you can have a gently declining population. I think indeed there are some benefits for that. I believe Japan is putting a lot of thought into how does it automate as many functions as possible? How does it continue to provide a good care of the elderly, even with a declining population? How do you automate the whole of your food production, which we can now do? So yes, I agree. You know, last time I went to Japan, actually, it was 1 week before lockdown last year. And of course, I've never been since. It was a pretty prosperous, perfectly pleasant place to be. But I think there will be some disadvantages if you literally get into a model of declining at the pace you can. Because let's remember, if you have a fertility rate of 1, right, each age cohort is a half the size of the one before. And so you go 2 generations, your population is then a quarter the size of the way before. I wouldn't want that for a society. I think most things in life, things are true up to an extent and up to a degree. And that's why I end up believing that, fertility rates 1.8, even 1.6, better than above 2, fertility rates of 1, probably too low. I have a theory that the optimal fertility rate is about 1.8.
Sarah, I'd like to hear you, if you wouldn't mind. Does your view of Japan as a prospect for us all accord with Adair's, or do you diverge from it at all?
No, I have to say, Adair, you described yourself as an amateur demographer. As a professional demographer, you have got a really good grasp on what's going on. So thank you so much. I mean, so often people talk about population and it's hot air, but you definitely seem to have grasped the basics of demography, which is wonderful. Yes, I do more or less agree. I mean, I think there are some things we have to be a little careful of. When fertility comes down to below 1.5 or thereabouts, we sometimes in high income countries get what we call the J effect, and that means there's a rebound, and we definitely see that in some European countries. However, if we look at Southeast Asia as a whole, and at Japan as well, so Japan, Korea, and the Southeast Asian countries where we have very low fertility occurring, they don't seem to be having that J effect, and I think that is really interesting. As Adair sort of mentioned, we have to look at the demography within the sort of cultural, societal, and economic context. And definitely, so about 20 years ago, I and some colleagues were invited by the Ministry of Social Affairs, I think it was, in Japan, to talk to them about how they could cope with their aging population. And one of the things they were interested in was bringing in migration. And one of the things we pointed out is that they wanted to use the British model. And, Britain is so culturally different from Japan. Our view was, no, you have to create your own model. And that is exactly what Japan has gone and done. And Adair is very right in saying that the way that they've used technology to supplement things like care and agriculture is obviously very advanced. And many countries, I think, are now beginning to use Japanese technology in the care setting. But then we have an issue that if we look at how technology is implemented within European societies, there's far more of a resistance than there is, for example, in Japanese societies. And finally, I would say that actually Japan has not only the highest life expectancy, it typically has very high healthy life expectancy, and the general well-being of both urban and rural older adults tends to be very high. So I think there's a lot of myth about what's happening in Japan. And I think the individual experience is actually probably much better. And as Adair has said, they are able, typically through technology, to be able to keep up their economic productivity. So I I think Japan is actually a good country to look at, and Korea is the other one. Korea is also aging very, very rapidly.
Thank you very much. I would like to ask Leticia what she thinks of the question suggesting a linkage between rich world aid to poorer countries and poorer countries' performance in reproductive health. And I'd like to broaden that out a bit, if you wouldn't mind just telling us quickly what you think of that one. I would also like to hear from you what you would like to see in aid policy that can help you in your work.
Okay, thank you so much for those questions. I think it's very interesting, and the discussion is very interesting so far. Yes, I agree with the first speaker that linking aid to reduction in the total fertility will not be a good idea. I think we have to situate the population discussion or the discourse in the broader health discussion. You know, we have to situate fertility within the healthy limits. What we need to do and know is that there are healthy limits in everything. I'm speaking as a public health specialist, as a medical officer now. You know, we have healthy limits. The human being, when you do your lab results, you have healthy limits for your sugar levels. You have healthy limits for your hemoglobin levels. Likewise, we have healthy limits for births, which is scientifically proven. Like the other speaker said, which I don't totally agree with him, that the total fertility rate of 1.8 is okay. Then where is the replacement? Replacement is 2. And replacement means that the 2 means even nobody is dying. And if we have to account for mortalities, then between 2 and 3 should be where I think the total fertility rate should be. And that is where the healthy limits also comes in. So linking aid to healthy limits, including fertility choices, should really be the way to go, not just the absolute total fertility rate. Because what really hurts Africa is the inequality in fertility, not the national fertility rate, but the inequalities in the fertility. You can have fertilities in the rich that are comparable to the West. Then you have in the poor that has high fertility. So concentrating, disaggregating the fertility in the areas and focusing on the health and economic integration is important, not just on the total fertility, linking it to aid. That will probably be, I think, counterproductive. But then situating fertility discussion in the health arena, talking about immunization and reproductive health services and family planning. There are 2 sides of a coin. Immunization immunizes against communicable diseases, and reproductive health keeps you safe from high-risk pregnancies. So they both have the same idea, and that is where I think the aid to support us should go. How do we reduce high maternal mortalities? We can reduce high maternal mortalities by reducing high-risk pregnancies. How do we reduce high-risk pregnancies, maternal mortalities? By looking at preventing high-risk pregnancies, and reproductive health situates there. So that is how I think that the aid supporting us should really be linked up so that it's targeted, it's intentional, and it ultimately will reduce the total fertility rate. Those are my
Thank you very, very much. That makes complete sense. We're actually slightly over time for questions, but I really want to ask Chaitanya, is clean growth an oxymoron?
No.
Can we have clean growth?
No.
I wouldn't get too caught up on the nomenclature around clean growth, to be honest, because as we've seen in the first panel, what are the alternatives? Degrowth clearly doesn't work. It's politically, it's suicide if we start talking about degrowth quite seriously. To be honest, no offense to the other speaker, I've never heard of A-growth before this conference, so I doubt how many people have heard of A-growth, I don't know. So I wouldn't get too hung up on whether we call it clean growth or otherwise. In the UK, if you look at the growth rates right now, they're very, very low already, and we're greening whatever little growth that we've got. The question is largely thinking about, balancing consumption, understanding our historical responsibility on climate change, our emissions, all of that. I think I'd worry about that more than whether we call it clean growth or something else. Sorry, that was a bit of an anticlimactic response, but
Not at all.
Well, thank you very, very much, all of you. Lord Turner, Dr. Leticia Appiah, Professor Sarah Harper, Chaitanya Kumar, thank you very, very much for a fascinating afternoon, and it's tea time.